Then here the definition of hormone is there. You have to learn important definition. It's a secretion from some glandular part of the body which is poured directly into the blood and which act on target organ or cells of the same individual, bringing about coordination between distant part of the body. Important definition hormone. Then we have to learn about some of the endocrine glands. Here you can see the endocrine glands in human body. In that only the bold the written in bold letters only you have to learn. That are the adrenal gland, pancreas, thyroid and pituitary. Only these glands you have to learn. Look here, let us first learn about the adrenal gland. You know that the renal, the word renal meaning kidney. So adrenal meaning that is attached above the kidney. You can see a cap-like structure, that is the adrenal gland. It has, like the kidney, it has also a cortex and medulla region. Then the main adrenal medulla secrete medulla meaning inner part, that is secreting the hormone adrenaline. Then it has a cortex region that is secreting the cortical hormone, corticoids. That hormones are known as corticoid. The main adrenal gland, you know that is helping the body to face the emergency situation. You learn the autonomic nervous system. When some emergency or at the time of any emergency, sometimes we have to uh, uh, do something on a stage. In such a situation also, it is an emergency situation, our body become prepared to that, prepared to prepare with that situation. Heartbeat may increase or the salivation may decrease. Such activity you learned in the nervous system, autonomic nervous system, that is controlled by the adrenaline. Here it prepare the body to fight or flight. Fight meaning to fight with the situation and to win, or fly away or run away from the situation. That according to the needed way our body has to behave. Also, the adrenal medulla secreting the hormone adrenaline, and it prepare the body to meet any emergency situation. For example, an aggressive dog approach you. Sometimes you may run away and escape from the dog and close your room. In such a way you can escape, that is flighting. Or you can fight. You can take a stone or a stick and can fight or make the dog run away from you. Either you can fight or flight. Thus the adrenal gland, adrenaline, help us to face the situation. That also may secreted at the time of excitement, or when you become angry, or at the situation of grief. These hormone help us. Adrenal gland, adrenal adrenaline, the medulla is secreting, that help us to fight or flee from the situation. Then again you learned about the functions of the adrenaline. Adrenal cortex region of that gland is secreting the hormone cortisol. Then the cortical hormone can be divided into two kinds, that are mineral corticoid and glucocorticoid. Mineral corticoid regulate mineral metabolism. You know that how the calcium is stored in the bone, or sometimes it may be dissolved from the bone. Mineral corticoid, such mineral utilization, or sodium, potassium ions, how it is utilized in the body. Sometimes it may be excreted out, sometimes it may be stored in the body. Such activities are controlled by the mineral corticoid. Mineral cortical hormones are produced by the adrenal cortex. Then glucocorticoid, that is regulating the metabolism of carbohydrate, protein and fat metabolism. When we consume more carbohydrate or protein cannot be stored in the body. It must be broken down in the liver. Such activities are controlled by the hormone, adrenal cortical hormones, mineral corticoid and glucocorticoid. Carbohydrate, protein and fat metabolism is controlled by the glucocorticoid. Sometimes increased blood glucose concentration or influence fat and protein metabolism, everything is controlled by the hormones, this mineral corticoid as well as the glucocorticoids. Then again, here another important thing about the cortical hormone, certain cortical hormone behave like the sex hormones. You can see in both the female and male, it can act like the sex hormone, and how it affect each individual. In an overgrowth of the cortex in young children lead to premature sexual maturity. If the cortical hormone is produced more in children, that may lead to premature sexual maturity. As well as one another thing, if the overgrowth of the adrenal cortex in mature woman, she develops certain male characteristics such as beard, mustaches and deep male voice. So the women show certain male characteristics if these cortical hormone are produced in female. The same thing will happen in the male also. If overgrowth occur in mature men, they may develop certain feminine characteristics such as, which are the feminine characteristics, that are the enlargement of breast or the voice may become soft. Such things also may happen in men also. So it can act like the sex hormones. Then again, its influence we learned. Then it's hyposecretion. Hyposecretion meaning if this adrenal cortical hormone are produced in low amount or in less, what will happen? That it cause hyposecretion, cause Addison's disease. What are the symptoms of the Addison's disease? What is hyposecretion? What is the disease caused by the hyposecretion of cortisone? Such a question can be asked. So, which are the symptoms of this disease? Addison disease, its symptoms are skin pigmentation, loss of weight, നോസിയ എന്ന് പറഞ്ഞാൽ ഛർദ്ദിക്കാൻ ഉള്ളതുപോലത്തെ തോന്നൽ, വെയിറ്റ് കുറവ്, ആൾ ഇരുണ്ട് പോകും, കളർ ലോ, സ്കിൻ പിഗ്മെൻറ്റേഷൻ മീനിങ് ഡാർക്ക്നെസ് ഓഫ് ദ സ്കിൻ. ദെൻ ഹൈപ്പോഗ്ലൈസീമിയ, ലോ ബ്ലഡ് ഷുഗർ, ആകെ ഒരു തളർച്ച പോലുള്ള സിംറ്റംസ് ആണ് അഡീസൺസ് ഡിസീസ് വരുന്നത്. സെൻസിറ്റിവിറ്റി ടു കോൾഡ്, പെയിൻ, ലുക്ക് ഹിയർ. സോ if this hormone is produced in less amount, hyposecretion, that the person may be sensitive to cold or pain. തണുപ്പ് സഹിക്കാനോ അല്ലെങ്കിൽ വേദന സഹിക്കാനുള്ള കഴിവൊന്നും ആളുകൾക്കുണ്ടാകത്തില്ല. അപ്പോൾ സം ഹോർമോൺ ഓൾസോ ഹാവ് സർട്ടൺ റോൾ ഇൻ sensing the pain as well as the cold, etc. You should understand these things. Increased susceptibility to infections, etc. In all as a whole, we can tell that the person will become weaker and weaker because of the hyposecretion of this hormone. Then again, you see the hypersecretion. If these hormones are produced more, the symptom, that disease is known as Cushing syndrome. That syndrome is known as, that disease is Cushing syndrome. What are the symptoms of this disease? That are obesity, overweight, hyperglycemia, higher blood sugar. Then osteoporosis, that are bones may break very quickly, soft, that may break. Then weakness, salt and water retention, that kidney will not excrete out most of the salt and water, so the body become weak, obese, the person will be obese. That are the hypersecretion of the hormone, cortical hormone. It is important points. What are the hyposecretion, what is the disease caused by the hyposecretion of cortisone, what are its symptoms, or like that, the hypersecretion, what is the disease, what are the symptoms, such questions you can expect. Then the next gland is known as the pancreas. You know that pancreas is a gland that is present behind the stomach, near the stomach, that pancreatic gland, its position. Then if you want to see the pancreas, its position, we can see where it is, there behind the stomach, that is the position of the pancreas gland. It is a duct gland as well as a ductless gland. Duct gland, it has a duct, digestive enzymes are produced in this gland, and it is produced and it is poured into the duodenum. As well as it is a ductless gland, ductillath ഒരു gland one. Certain cells are producing these hormone producing cells are present in the pancreatic gland. So special cells, hormone secreting cells are present, that are known as the islets of Langerhans. You can see the close view of an islets of Langerhans. Certain special, a portion of the pancreatic gland is shown here, and here you can see the hormone secreting cells, like an island. Islets meaning island like portion, little island like portion, islets of Langerhans. The hormone producing cells of the pancreas, name the hormone producing cells of the pancreas. Question may be can be asked like that, islets of Langerhans, which is scattered in the entire gland, like island, all pancreatic gland, in certain parts of like spots, these glands can be seen. Then they are producing, three hormones are produced by this gland, that are insulin, glucagon and somatostatin are the three hormones produced by this pancreatic gland. You always hear about the insulin. Insulin is used to check the sugar level of the patient. It is produced in the pancreas. If some persons cannot, their cells cannot produce enough insulin, in that case they are taking insulin injection to control the sugar level, or they may take the tablets to control the sugar level. Insulin is produced if we consume more glucose with our food, if you take more carbohydrate food, or we consume more sugar containing food, this sugar must be deposited in our liver or in our muscles as glycogen. That is the function of the insulin hormone. Insulin, with the help of the insulin, it is converted into glycogen and stored in the body. But in certain patients, their insulin, if it is not working properly, then they are taking injection. So the insulin is produced by the pancreas. Then glucagon is its action is opposite to that of the insulin. It is stored in the body and stored as glycogen. This glycogen, at the need of emergency, when we do not get enough food, this stored glycogen must be again changed into glucose. That part is done by the hormone glucagon. Insulin is helping to store the food. Glucagon is used to dissolve that or to bring back the glucose from the glycogen. That is the function of glucagon. Then somatostatin, that is not included in the syllabus, but its main function is to control insulin and glucagon, that is keeping the balance. That is the function of the somatostatin, that is not in the syllabus. They are produced by, insulin is produced by the beta cell, and glucagon, the second glucagon, is produced by the alpha cell, and the somatostatin produced by the delta cell. This also, insulin is produced by the dash cell. Such a question can expect. Insulin is produced by the beta, glucagon by the alpha, and somatostatin by the delta cell. That is the thing you have to learn about the pancreas.